morning. My name is Jessica. I'm a nurse today, and I'm going to be doing an assessment. Is that okay?
Yes.
Can I have your full name and birthday, please?
Dashane Pointer, 6/20/92.
Okay. I'm going to provide privacy. I will sanitize my hands. And I am going to be doing an assessment that involves your hair, your head, face, neck, skin, nails, and lymph nodes.
Okay.
All right. Oh, and some cranial nerves too.
Okay.
I am going to start by inspecting your hair.
Okay.
Nice haircut.
Thank you.
All right. Good. Your hair is full. I see even patterns. I do not see any signs of alopecia. Now I'm going to touch you, okay?
Okay.
And I am feeling for the texture of your hair, and it's nice and thick. I do not feel any brittle hair. I don't see any signs of, thank you for turning. I do not see any signs of infestations or, I'm looking at your scalp now. Your scalp looks nice and healthy. Skin is good and healthy. I do not see any signs of like fungal infections. I do not see any signs of dryness or any dry skin or flakes. Now I'm gonna go ahead and feel for your skull, okay? All right, it feels symmetrical. I do not feel any masses. Good. Is any of that tender at any point? Okay, good. Looks in good condition. I'm gonna move on to your face and neck. All right, your face is symmetrical. Your eyes are in proper position. Your eyebrows too. Nose is at midline. Can you make a smile for me? All right, good. Face is symmetrical with and without movement. I am going to go ahead and move down to your neck now. I'm looking for any signs of JVDs, and I don't see any protruding JVDs. I see a slight pulse of your carotid, which is with the normal range. Now I am going to touch, which is also palpate, your trachea. All right. Can you swallow for me? Okay, good. Your trachea is at midline and it moves properly. I'm looking for your skin now. Your skin, it has a nice even dark tan color. I see a little bit of sun exposure to the outside of your arms. I'm looking for primary lesions, and I see that you have some in the form of macules on this side of your face. One here, and now I'm looking for any signs of secondary lesions. I see a secondary lesions in the form of a scar on the bottom of your lip there, some on your knee, both knees. I do not see any signs of vascular lesions. I don't see any spidey angiomas or varicocytes. I do not see any swelling or open areas. I see no redness, which is good. Now I'm going to go ahead and feel your skin. Temperature is nice and warm all throughout. Maybe slightly down to your lower extremities, which is normal and expected. It's within normal range. I am going to inspect sugar of your skin and test hydration. It's good. Hydration is good. I am going to go ahead and take a look at your cap refills and your nails. All right, your nails they look healthy. They're nice and thick, but not abnormally thick. Your nail bed is nice and pink. Can you go like this and let me see your nail? Yeah, like that. Good. And then can you do the same thing for the other one? Good, good, good. Okay, good. I don't see any signs of clubbing. It's normally concave, but it's with the normal range. It's a normal degree. I'm gonna be doing the same thing for your toenails, okay? I see that you have some nail polish that is nice, bright and pink, but I'm also looking at your nail. The nail bed is nice and pink on the areas that I'm able to see. Good. The thickness of your toenails are with the normal range. I don't see any discolorations like fungal infestation or anything like that. It looks good. All right. I am going to remove my gloves. I will sanitize my hands now, and I am going to kind of go back and check for cranial nerves. I'm going to start also by looking at your lymph nodes. All right. I'm going to palpate. At first, I don't see any signs of swelling, redness, so I'm going to palpate your occipital lymph nodes, mastoid. Okay, I don't feel any hard masses. Was any of that tender?
No, ma'am.
All right. Parotid, submandibular. Okay. I'm also gonna feel for your lymph nodes on your face, starting by the ones around your eyes. Okay, good. Nose. All right, good. Was that any of that tender at all?
No, ma'am.
Okay. The ones on your neck. Okay, good. Everything feels fine. I don't feel any hard masses. I do not see any masses either. I'm gonna move on with your cranial nerves, okay? We're gonna be testing cranial nerve 5, 6, and 7. First, I am going to put some pressure here. I'm gonna put my hands here, and I want you to put some resistance, first to the right and then to the left. Okay? All right. Now, can you stick your jaw out? Okay, good, good. Can you place your tongue on each side of your cheek? Good job. All right, can you puff your cheeks? Okay, good. Now I'm going to ask you to close your eyes and tell me where do you feel the areas I'm touching. This one test nerves 5, okay?
Left upper, left, right middle,
Okay,
left lower, right lower, right upper.
okay, good. Now I'm gonna see if you can follow Pearl. All right, I'm gonna ask you to keep an eye on the pen.
Okay.
Okay, good to accommodation.
Okay.
Can you tell me when you first start seeing my fingers?
I can see your fingers.
Okay, good. Can you follow my finger? Okay. Now I'm looking for my flashlight. Oh, it's in my pocket. All right. And I am just looking for Pearl reaction. Good. Good. I'm gonna do it one more time. Good. Good. All right. Good. All right. That's all for the assessment I had today. Do you have any questions?
No, ma'am.
All right. Thank you.
Thank you.